In King County, there are so many people living in vulnerable situations who could thrive with just a little help. People without vast resources, or who might not speak English. People striving to build a better life. These are our neighbors, fellow human beings who face critical this or that decisions every day, whether to eat or pay the rent, whether to seek medical treatment or wait a little longer because care costs too much. For 54 years, we've provided quality health care to anyone who needs it, regardless of circumstance. We do that by expanding care, not limiting it. That means saying "and" whenever possible to our patients. Our care model combines medical and dental and behavioral health care at every clinic location. Highly integrated care that treats the whole person. We also offer nutrition counseling, alternative medicine options like acupuncture and naturopathic care, and on-site pharmacies. Our goal is always to lower barriers and increase access to care. Our obstetrics team recognizes that pregnancy and parenthood impact entire lifetimes. We combine pregnancy care and education and community building to give families the support they need for healthy starts and healthy futures.
We started looking towards models of care that already existed, and we landed on centering pregnancy, which is a really evidence-based model of care used nationally, but never before conducted in Dari, which is the language that most of our patients at that time were speaking, and certainly never done with newly arrived refugee families.
We group women by their due date and by their language majority, and so we've had a number of Dari groups, we've had Spanish groups. We're able to bring them services like connection with dentists, connection with WIC and public health, a tour of the hospital, and a real sense of community between them.
Addiction to opioids and other substances has impacted thousands of families in our community. It's a complex issue, which is why we offer treatments that combine counseling and medical support and primary care while we continue working to reduce stigma.
So substance use care at HealthPoint is really about meeting the patient where they are. And we do that both inside the clinic and extending beyond the clinic with our patient care navigation services that we have. And that really, out in the community, we're trying to build trust. We're trying to connect with patients on their grounds, where they feel safe, in order to be a bridge, a safe place for them to walk into our clinical care services. And that includes primary care, behavioral health services, dental services. But it's really kind of connecting all of these pieces together and seeing the patient as someone who is a whole person, not just their substance use disorder, and providing them with the ability to control their agenda and to control their experience in the clinic, which they so often are unable to do.
The way they integrate everything and the way it's been instrumental in me going forward and being in a position to make the success that have the leaps and the bounds in my sobriety, my recovery, has been because of that, because of the whole care team, because of the communication. There has been no downtime where, well, let me talk to this and let me get word from him. And it's like they're always on the same page. I feel like I got a team. I do have a team, in you guys, and that's my support team, and helps me build my confidence. I build my confidence. I build my self-esteem to a place where I can make the success and the leaps and the bounds that I have, because of the efficiency of the team here.
At HealthPoint, the ands go beyond medical care. To thrive, families need access to healthy food, housing, insurance, and employment opportunities. We help connect people to these services and more. We also put clinics and community centers where families already gather, like the Family First Center in Renton and the Together Center in Redmond. It's no coincidence that when healthcare is more available and more convenient, people are healthier.
We wanted to approach this opportunity with integrating as many services as we possibly could. And we knew that there were some experiences that we could adjust for folks, whether it be adults who are new to American culture and American way of doing things, and also just young folks who typically have a hard time going to their dentist's office or going to get their immunization shots. And so this was an opportunity to put that health clinic in the community center, invite those folks in here to a space that's designed for them so that they feel comfortable enough to go get the health, dental, and behavioral services that they need. And it's been a beautiful partnership.
Making healthcare more equitable requires a lot of ands, but that's always been the ethos of HealthPoint, to strengthen communities and improve people's health by delivering quality healthcare services, breaking down barriers, and providing access to all. Human beings deserve the maximum amount of kindness, not the minimum. Please help us build a healthy future for your neighbors and our community. Help us give the world more and